The CECC is considering revising its home quarantine rules amid rising COVID deaths, many of which occurred unexpectedly while the patients were quarantined at home or in designated quarantine centers. It may decide that in the future, only those under the age of 60 with no history of chronic diseases can be quarantined at home. The rest will be sent to hospitals or quarantine centers where they'll be closely monitored.
With daily number of new cases in the hundreds, COVID deaths have also been on the rise, many of which were sudden deaths that occurred at home or in quarantine centers due to silent hypoxia, which is when the body is deprived of adequate oxygen supply without experiencing shortness of breath. In response, the CECC is drafting new hospitalization guidelines so as to closer monitor patients' blood oxygen levels.
Some
risk factors for severe COVID symptoms include evidently advanced age as well as underlying conditions such as high blood pressure and diabetes. But that is not to say that young people will not experience severe symptoms.
The CECC Specialist Advisory Panel has laid out new guidelines for hospitalization. Patients with little or no symptoms under the age of 60 and with no underlying conditions will be home quarantined. As for those above the age of 60 and those under 60 but with underlying conditions, they will be sent to medical or quarantine centers where they would be closely monitored. Patients with severe symptoms will be sent directly to hospitals for treatment. Doctors have also reminded patients to keep a close eye on their conditions. Patients should directly report to health authorities if their respiratory rate exceeds 30 breaths per minute, their blood oxygen level drops below 95%, or if they experience tightness or pain in the chest or shortness of breath. Young patients should also stay vigilant.
In severe cases, the most crucial condition to look out for is shortness of breath. If you feel like you're running out of breath, then you must know that this is a very dangerous symptom. And if you experience this, you must report to health authorities immediately for treatment.
Whether the outbreak can be overcome still depends on the vaccination rate that may lead to herd immunity. Health Minister Chen Shizhong recently pledged to have 60% of the population receive the first dose by October. That translates to about 13.8 million people. This means around 110,000 doses will have to be administered daily in order to reach this target, one that would not be reached given the current rate of vaccination.
If there are enough doses, then maybe we can consider mass inoculation, for example, by administering vaccines in large stadiums or other similar venues. On the other hand, if there are only around a dozen or so cases in a neighborhood, then maybe we can consider loosening restrictions in these neighborhoods.
Doctors believe that in light of the flattening of community infection trends in Western countries, where vaccination rates have not yet reached 60%, it may well be possible for Taiwan to contain the outbreak before reaching herd immunity. Still, whether vaccination rates will speed up depends on the arrival of vaccine shipments.